And we are live. Good evening, everyone, and welcome to the Nutritionist Corner Dialogue. And today we're going to talk about something that everyone is talking about, but we're going to lay focus on something that everyone is missing because I've seen a lot of posts and discussions about policies, maybe one of those people who are challenging the policies. We have also had conversation about how to support mothers, including fathers, making sure that the community is involved in when it comes to development, implementation, and even mapping out of these problems that we have that surround breastfeeding. But we have not had very loud conversation. I'm sure they're there, but they're not loud about breastfeeding in difficult circumstances or some of the challenges that make breastfeeding almost impossible. And that is where we have our guest for tonight. She's called Elizabeth Ntalalai. I hope get jina vizuri. She's a registered clinical nutritionist and she is also pursuing specialization in pediatric nutrition. I will allow her some few minutes to introduce herself. But before then, let me just introduce you and why introduce the corner and where we are doing this. So my name is Lilian Momina. I'm a registered clinical nutritionist and I'm one of the co-founders of the Nutritionist Corner. This is a platform that was established to bring together professionals from all across Africa and globally to talk about matters nutrition, to amplify the issues that we have, to make sure that we are trying to empower professionals through webinars, through education sessions like this one. So sure that you follow us. My co-partner is held up somewhere, but if she finds time, she'll also join in. But in the meantime, allow me to introduce our speaker or to get our speaker to introduce herself. Elizabeth, karibu sana. Kindly tell us who you are, what you do, and pale tunaweza kupata physically or even online if we were to be interested in associating with you further before we start.
Thank you, Momina. My name is Elizabeth Talalai, a registered clinical dietitian working at Mile 46 Health Center. I'm also pursuing a pediatric nutrition specialization and also pursuing a master's in science in food nutrition and dietetics. And my main agenda here is maternal nutrition. I'm very passionate about it, about maternal nutrition and child health. And my social handles are at Ntalalai the dietitian, Instagram, TikTok, and also Facebook. You will get me there. Thank you.
Elizabeth, kindly confirm if you can hear me because I lost you for a moment and I don't know if it's my network or if it's your network.
Yes, I can hear you, but you're breaking.
Elizabeth, and I'm breaking,
You, yeah.
Okay, that is bad. I hope things will get better as we continue. Now, the whole of this week, as I said, we have seen a lot of noise about breastfeeding, good noise by the necessary noise about breastfeeding. And tonight we want to talk about or to talk to mothers whose journey is often overlooked because we say breastfeeding, ama mimi tunasemanga ya mama ndio best, but what happens when breastfeeding is not straightforward? What happens when the baby arrives too soon, prematurity? What happens when the mother is critically ill? And what happens when the baby is admitted to NICU? Or even if they are twins or multiple births, quadruplets, triplets, and when heavy medication for chronic conditions like diabetes, hypertension, mental health disorders, or any other chronic condition, or when the mother must leave the baby earlier than anticipated. So tonight you're going to talk about that because we want to make sure that everyone is as included as it can happen because these are some of the things that happen in our realities. We all know someone, we all know a friend, a colleague, a relative who struggled with their birth. Either they were hospitalized after childbirth, either they had premature babies, or they had preterm births, or even they had multiple births and something like that, or they were on heavy medication that interfered with lactation processes. So allow me to ask you, our audience, what are some of the challenges that you have come across as a professional or as an individual that might actually hinder breastfeeding? And then we can get into the discussion. Elizabeth, kindly confirm that I am audible.
Yes, you are.
Good, good. So as I was saying, many people, majority of people actually assume that breastfeeding is a natural process, that once I am able to get pregnant, to go through pregnancy, childbirth, and all that, I will be able to just remove my breast, attach the baby, and milk will automatically come out. But I'm sure as a professional, you know, it does not always go like that. So from your own experience, from your own interactions, what do we really mean when we say that we are talking about breastfeeding in special circumstances?
Breastfeeding in special circumstances means a lot. It means that we either have an infant that was born earlier before the exact time, a premature, or a low birth weight baby, or a baby that is in NICU, or a baby that the mom is undergoing any of the medication. It's just a baby that is facing some challenges when it comes to breastfeeding. And this way, breastfeeding is normally not straightforward, but with the right support, you will get to initiate the breastfeeding, especially when it comes to either a premature baby, a baby on the NICU section, or a mom who is under medication and she still needs to breastfeed the baby. And these are some of the challenges that they are facing. Also, for a mom that is working and she knows maybe in 1 month she only has either a month. Maternity leave and she needs to go back to work, she needs to understand how she will leave her baby and to ensure that as she goes back to work, the baby is still consuming breast milk. Yeah.
Thank you. Thank you. So those are some of the special circumstances and maybe others that we will definitely be getting deeper into later on, not today. We have the physical barriers, the physical barrier that makes it almost impossible. They can also be termed as special cases of breastfeeding, where we have like a mother with inverted nipples, a mother with flat nipples. We have a baby with tight tongue, we have cleft lips, and we also have babies born with cerebral palsy or other developmental issues that they are not able to physically latch. So remember that if you are that mother, if you are that relative of a person who has such, support exists. That is why people like Elizabeth are here, and that is why at the Nutritionist Corner we also exist. So we can refer you or we can also work with you. So try as much as you can to reach out for professional help, because even in such circumstances, we have pumping and we also have monitored feedings that can actually now help the babies or those babies who are not able to physically latch and breastfeed, ensure that they are getting nourished. So there are so many other ways that we can support breastfeeding, but you're going to talk about that. So let's talk about why is it that as a healthcare provider where you're working Ntalalai, majina za hii Kenya ni mingi. What are some of the most common conditions that you have come across? I have mentioned a few that will actually need specialized care, and in your own understanding, is that care given to those mothers in special categories good enough?
Some of the cases that I've come across working at a community setup currently are engorged breast, inverted nipple, flat nipples, and these are some of the issues that we normally come across, and some of them end up having mastitis. And with that, we try as much as possible to sort out those issues. And sometimes they can even go home and come back before. Sometimes there are some issues here and there. Maybe a client has gone home and those problems happen, challenges happen there at home. When they come back, we ensure that we sort them out. so that the baby can continue breastfeeding, and teach them some of the issues that they might be facing and what to solve at home.
Thank you so much. Thank you so much, Elizabeth, for that. And I like the fact that you have talked about teaching them. Now, is it that, we usually say that our main problem with our government is that we are reactive. Why is it that we are not able to prepare these mothers for possible outcomes? Because let me tell you, I am sure you're a mother. I'm also one. And if I was not a professional undergoing my ANC delivery and post delivery and all that, I did not even have someone talk to me about the possibilities, things that can happen. And they do happen. Is it that we are neglecting these mothers? Because you see, there are those mothers, there are those communities who still have beliefs about babies who are formed with either physical deformities, like maybe the cleft lip or the tied tongues. So they might not be willing to come back to the facilities for assistance. And this now they'll start looking for other alternatives, traditionally or even local arrangements, and this will actually interfere with the baby's health. I recently heard of a community in Kenya, in Western region, where the firstborn, if they are born twins, it's a problem. Now, those are some of the things that we are supposed to engage mothers, but we don't. At your own personal understanding and as a professional, what are some of the things that you think that we need to spearhead? Because you're working in the community. That is where we need to talk about a lot about the preparedness before it happens. So what are some of the things that we should be spearheading at the community level to ensure that these mothers are on board? And when such things happen, they're not shocked, they're not terrified, and they're able to comfortably seek care and help.
Some of the things that I
Elizabeth?
think, some of the things that I know we can really prevent before ending to the side that is not good are during ANC, educating the mothers on all the issues about breastfeeding, the challenges that they might go through after delivery is very vital, because this mom, when she's delivering, she will understand what she's supposed to do in such a case. And with this, I normally see when it comes to the mother support groups, they really enhance this communication, because I use the maternal MYCN cards to teach them and show them directly this is what is happening, and with this is how you will sort out these issues. We'll just have quite some few numbers here and there that maybe are not in the mother to mother support groups that might face the problems and might also be listening to their caregivers back at home and following the cultural practices of some of the issues. If they see a baby is behaving this way, they need to do this according to their culture. Those are some of the things that we talk about. As currently with the mother support groups, I normally ensure that that is a message I make sure they hear, see from the chats, and know how to sort them out. So I think with that concept, we can really save a lot.
Yeah, and maybe I would like to know, when they're coming up with the mother to mother peer and support groups, why is it that they exclude some people? Because I have this, my recent delivery is my second delivery, and I was not approached the first time to join a mother to mother support group. And the second time, I was not even referred or approached. Like, I even asked about it, wataniambia kama iko, and tukazaa bila. So what are some, this is just out of curiosity. Hii si sasa ya watu wengine, ni yangu sasa. What is the criteria for you to be in that mother to mother peer and support group at the community level? Because that is where most intervention should be taking place, and they're not.
At the community level, those that are supposed to be in the mother-to-mother support groups are mom with infants, with babies who are below 2 years, and also the pregnant mothers, the lactating ones, those who are exclusively lactating. Sometimes also add in the community setup that I have, we add TBAs, CHPs are also there, and there's also a nutritionist as one to air out the education that they are supposed to listen. So with that, the CHP is the one to find the mothers in her area, and sometimes we refer them from the facility, because not all mothers will come and deliver at the same facility that I work. So she'll have also to find other mothers back at home, since she understands the community she's working in, or the village she's working in. So she will be able to identify them. Those are some of the criteria that we use to enroll mothers to the mother support groups. Yeah, and also grandmothers. Sometimes we even include grandmothers because they are the champions of when it comes to exclusive breastfeeding. They don't know the need. Why are we the importance of breastfeeding? They might also be the ones that are hindering exclusive breastfeeding. Exclusive breastfeeding. So we also include them to come and get the knowledge instead of being told by either the mothers, their daughter-in-laws. So that is something else that we have tried to curb on this end.
So in a nutshell, ni mimi nitafute CHPs and include kwa the group. Maybe because I might be in the urban or in the capital, that might be the problem, but realistically they should have located me. Mara ya pili pia, I can write a complaint on discrimination.
I
Because they
normally
don't
see,
know uh-huh.
I normally see, like in the urban setup, it's very hard to identify everyone. But in the rural setup, you can get to know everyone around. You understand this client is from this household, and the number of, especially in the community setup that I am working in, you might find that there are so many households in one area, in one homestead. So you can identify how many mothers can enroll to this mother-to-mother support group that you're supposed to be holding in this certain village. So I think it's a challenge in the urban area.
I agree, and we need to do something about it because nikunoma, because we can't have 2 times na sijapatikana. What if I needed the support? But I understand with you. And the worst thing is that in the urban centers, that is where most mixed feedings are happening, either mixed or replacement. The data is saying that wamama wanafanya exclusive breastfeeding, but the women in towns or the women in the urban cities are the first ones to get formulas. They're the first one to because they are woke, they want to go back to their lives. So they're the ones who might need the interventions more. The nesting part that comes with childbirth, the kulea, hiyo kukaa tu ukijitunza ukilea, it's not happening in the urban cities. Mtu amezaa anataka aende afanye vitu ni kama hajazaa, it's really happening and it's a problem. And I think that should be part of the special cases, but that is a discussion for another day. Let's go back to what we were discussing. Now, we are talking about some of the special conditions or the special situations that might require extra support when it comes to matters breastfeeding. And we've identified NICU as one of them. Anytime that a mother delivers through NICU, no one gets pregnant to end up in NICU. It's usually either an emergency. Of course, in most of the time, it's an emergency, like all the time, either an emergency, a preterm, or something that has happened that has caused the baby to be either low birth weight that requires NICU admission, or a sickness, maybe jaundice, that requires admission, or any other on the neck that requires clinical ICU NICU. Now, when you're thinking about that mother who has a baby in the NICU and she needs to continue feeding the baby and she cannot initiate breastfeeding according to our baby friendly community or health hospital initiatives, where we are telling the mothers to latch the baby, telling the mother to breastfeed on demand. This is a baby who's on maybe oxygen, who's on they're not able to physically feed. So what are some of the support that such mothers should be getting? Because sometimes they are discharged from the hospital to you now in the community. I'm sure if the referral system was working as it should be on paper, they're supposed to be discharged from the facility. They are given to someone like you now to continue with the support until now breastfeeding is comfortably established.
For prematures, when they are discharged to the community, they first at first contact, I have to know their weight. After identifying their weight, and also ensure that when they are breastfeeding, they have to first express, they do the cup to cup and then top up. There's a way they do the top up so that they ensure that the baby is getting enough breast milk. So after, on a weekly basis, they visit the facility. I check their weight. Are we adding weight? Or after every 2 weeks, I check their weight. Are we adding weight? What are some of the challenges that the mother is facing? If there are challenges that she's facing, I will have to identify. A good example, maybe she's stressed. She's maybe she's stressed, she's not getting enough support at home. So I will identify that problem and give her a solution according to the current problem. Or maybe she's not also consuming enough fluids to be able to produce enough breast milk during that time. So those are some of the things I would do to her.
And now, because you have talked about we are establishing and re-establishing and supporting breastfeeding from the hospital admissions for patients or for mothers who had their babies in the NICU. Now, this mother comes to you. Maybe they were so scared, or the baby was feeding other feeds. Maybe they were not able to produce milk. Maybe the mother was so much stressed that hangetoa maziwa, hata akikamua nothing was coming out, so the baby maybe got used, or even hata akitoa the pump feeding, the tunapeanga watu na syringe nayo, it's called what, that type of feeding. I'm sure you understand in that. So akitoka kwa facility, now they come to the community, and you have now you say that you giving them cup feeding, wanakamua, wananyonya, wanakamua, wanapewa na kikombe, and they are topping up. Now, how easy is it to now to comfortably, if the mother decides not to pump, they want to breastfeed, because it's easier to breastfeed, that to directly feed than to pump. If the mother wants now to go back to directly pumping, how easy is it and feasible is it for them to transition from the cup feeding? Because I also understand that the baby atakuwa maziwa kupata mingi at once, because kikombe sio kama matiti inatoka kidogo kidogo. What are some of the do women struggle? And if they struggle, what are some of the things that you do to ensure that they comfortably transition into feeding directly?
During the cup feeding or either the NGT at the facility level, what they are supposed to do is, when they empty the breast completely, while they are using the NG tube to feed, they should put the baby to the breast so that they can start learning how to latch and understand the suckling reflex. Also start to learn their personal sucking reflex on how to do it, so that with time they will know. It will be easier to transition to the cup, and again it will be easier to wean off from cup feeding completely to the breast.
That makes sense. That makes sense. And now another common question, sometimes the mother might fail to do that. And that is one of the common challenges that mothers might come to you with. Like, alitoka ho, sina mtoto mwenye hajajua hata kusuckle at all. So when the mother comes, what are some of the other mistakes that they might come with you? The transitional, I want this to be very clear for someone who comes in looking for solutions that they have gotten from the hospital. No, they want to now transition to the community or to at home to ensure that they support breastfeeding. Let's say mtu kama mimi mwenye, ama the urban ladies or people from the urban centers who do not have a community like the ones that exist at the rural areas. So what will these mothers come to, what are some of the challenges and how can they overcome them?
Some challenges might be in terms of support from their partners. I noticed that at the home level, at the household level, if you're not getting enough support and you're still stressing on other things like providing for the family, you're making sure everything is in order, it's very hard for you to stimulate milk production. The hormones won't be produced by that. And with that, one of the things that I would tell them that if just know if you're stressed, you won't produce enough milk. So make sure that all the other house chores that you are supposed to be doing should be handled by someone else. Don't feel guilty about it. Let other people deal with that. Then you can deal with the baby, as also they help you to they also help you with giving you meals, providing the right meals so that you can be able to produce enough milk. Express, just learn the technique of expressing. And if you're not comfortable with hand expressing, you can use either the pump. It will be easier. And one thing I noticed, when you're in the hospital wall, there's always that notion that your body is not well relaxed. But when you go home, some things just fall automatically into place, especially when it comes to producing enough breast milk. I think there's just some environmental shift that happens when the mom goes home, and with that she identifies that ever since I came from the hospital, I am now producing more milk before. I don't know whether you've noticed that on your end.
Of course, that's definitely happened, because I think the still environment is so stressful for anyone. So I think when the mothers go home, it becomes easier for them to even produce and breastfeed. They're more comfortable. I like the fact that they come home to a support. I think this is something that should be replicated everywhere, regardless of whether we are in the urban setting. Because where I live, tunaishi watu households za watu wangapi? 6 times 3, that's 18 households. See, that's a whole community. That's like a whole unit. So hapa we should be having support groups, but they don't exist. I've never seen anyone. Those promoters, the CHPs, I only see them sile watu wanakuja kufanyiwa polio, hiyo campaigns peke yake, wakiniambia wanataka consent ya mtoto apelekwe afanyiwe, adungwe shindano ama vaccinatiwe, which is quite unfortunate because you are not prioritizing. That means it can be done, because it's usually done for vaccination. So it can also be done for breastfeeding, but they do not think it's necessary. That is another problem that we have with our current government. Anyway, I hope things will change, but as we move forward, now some mothers might be hospitalized because of conditions like hypertension. Maybe someone had diabetes, gestational diabetes, so they were being managed in the facility, and now they have been released to you in the community. Now they talk to you, they come to you, and they are taking medication. And as nutritionists, we are supposed to try and reduce as much as we can the drug nutrient interactions, especially for mothers who are breastfeeding and just for anyone else, and try to as much as we can to make sure that this medication still works for the benefit of the mother, and we still continue to produce breast milk. But we know for a fact, I know for a fact, I can tell you my experience, when I got the C-section, of course, I was given a lot of not unnecessary medication compared to the vaginal delivery that I had previously. Yeah, so the medication that I had, I think within the first week, interfered with my breast milk production because my supply was not as I anticipated. Because I was like, this is the second time, so the supply should be easier and it should be better and it should be faster. But that was not the case. In fact, I was latching, I was doing everything right. The baby was still suckling the small colostrum. I didn't waste anything, nothing went to waste. Zote zilikuwa naingia kwa tumbo yake. But I felt like my supply was a bit limited by the medications that I was taking. I was given painkillers for like almost 2 weeks. So I stopped medicating myself. I stopped with the painkillers because after the antibiotics, I was like, now I can sustain the pain to try and make sure that I try and produce breast milk. Because when I stopped the first day, I noticed that my milk supply increased. So when people come to you, now mtu ametoka hospitali, they're on medication. Maybe they had hypertension, maybe they had diabetes, maybe they had tuberculosis, or they have mental health conditions that require them to take medication. What are some of the things that you take them through to make sure that these medications still work for their betterment? And how do you make them understand? And how is the support like for such mothers?
Okay, for for such medical conditions, depending on the medical condition that mom is facing, like let's say hypertension, for the antihypertensive, it is only a minimal amount that is passed through the breast milk, and so it's safe for the baby to continue breastfeeding. So those are some of the factors that I would be looking at. What are the type of medication, and is it okay for the baby to continue breastfeeding, and reassuring the mom that mom, you can still continue breastfeeding. The medication will not be on a negative effect to your baby. It is supposed to help you ensure that you're well and you can also continue breastfeeding your baby. The only thing that she will do is to ensure that the baby is consuming, let's say, like for you, you're saying you are seeing the amount of breast milk was the supply was little. I think the ensuring that the baby breastfeeds on the two breasts at the same time can do some kind of way, like emptying one breast, and then if you see they are not full, you let them empty the other one as they wait for the second time to breastfeed. Also, for those clients who are diabetic, there's no any problem in terms of them when they are using insulin. There is no any insulin that will go through when the baby is breastfeeding. It won't go through the milk. It won't be delivered to the baby at any chance. The only thing they will be very careful about is they will watch on the hypoglycemia to ensure that they don't get hypoglycemia at that time. Also, let's say for clients that have TB, the baby is also given some medication, and both the mother and the baby will be safe. The medication that the baby will be given is to prevent them from getting the tuberculosis. And for mothers that are HIV reactive, they will also exclusively breastfeed, also consume their ARVs, and also give the baby their prophylaxis as advised by the clinician on that end. So this will be an assurance set where I will tell them that, ma'am, all mothers at this state can breastfeed their baby, exclusively breastfeed their baby, no matter the condition that they are going through.
Yes, and I like the fact that you have said that you will talk to them, you will work with them and make them understand the type of medication they are taking and how it affects their body, their excretion pathways and such. That is why it's very important for you as a breastfeeding mom. If you know you are pregnant, or if you're planning on getting pregnant and you are on long-term medication with a chronic disorder, or you have hypertension or diabetes, or you develop that after childbirth and you're released, it is very important that you work with a nutritionist. Let's not ignore the fact that we need assistance and that support that we are actually ignoring. For me, it was easier to effectively uh, go full time or full term mode when it comes to breastfeeding, because I'm a nutritionist. I was able to check on the medications that I was given, to increase my water intake, to make sure that I am trying as much as I can to make sure that I'm supporting my body so that it can produce milk and heal and still accumulate the medication that I was given to prevent infections and all that. But you see, if you leave the hospital without such knowledge, you might have, and you don't get the luxury of meeting Elizabeth, you might get issues. You might start getting worried about supply. You might not know what to do, and sometimes it is not optional for you to get rid of the medications. You have to continue taking them, and even if you're taking them, you need the support. So let's look for support. And I think we need I am going to challenge myself. I'm going to get a WhatsApp group for this community that I am in, and I'm going to have a mother to mother support group for this area and see how many mothers I can catch. But I don't know. I don't want it to have my number. I will see what to do. But that is a challenge. Then I will go to the community, to the county, and complain about all these mothers not being able to get support and see what we can do. That is something I can do, because I think what you're doing, the fact that from the hospital they come home and they have access to you, that is very beautiful and should be replicated everywhere. But again, you're also overwhelmed because niko sure mko wawili ama watatu. We need more of you in those communities so that it can be better. Whatever you're doing can be amplified times two. So yeah, all will be well. So let's talk about when is breastfeeding really contradicted. Can we talk about if a mother will be told not to breastfeed, a mother who's hypertensive, who's diabetic, who's having HIV or tuberculosis? Do we have cases where we are going to tell the mother not to breastfeed?
Yeah, there are some cases, let's say those that are maybe a mom delivered, and in some case, you might find that she has been referred to an intensive care unit. Now let's say she's not fully alert, so she won't be able to express and she can't be able to breastfeed her baby. Those are some of the cases that I had seen while I was working at a level 5, and with those cases some interventions that were done, uh, I won't mention the intervention because it might contradict the people, but some interventions that are normally done during that period when a mom is not fully alert and she has been transferred because of some medical condition. She has been hospitalized at the ICU level. You find that the baby is given other things, and she's not. The baby won't be consuming breast milk, so they are given other alternatives, but will suit the baby at the end. Momina, can you hear me? Momina?
Hi, Elizabeth.
Hi, I can hear you now.
I'm sorry, internet ilifanya ile maneno. Where were we? We were talking about the situations where the mother might be not able to breastfeed. You can continue kama hukumaliza.
Let me just repeat it. Okay, for a mom that is has in some case, I had to encounter a mom that delivered and she ended up being in the ICU, and so the baby had to be given other alternatives of for them to continue breastfeeding. And the alternative in this case, it's not donor milk, and in that case, the baby continued. The baby was given formula because of that situation the mom had gone through, and she wasn't able to breastfeed since she was unconscious. So in some cases, let's say 1% of it, not all cases will be the same as hers. Yeah.
So this is for the mothers who think that because sasa alipatikana na PT or they had blood pressure or blood sugar issues during pregnancy, they don't want to breastfeed. You can still successfully, even if you're taking ARVs, your TB medication, you're still encouraged to breastfeed, provided that you are attending your clinics well and you will not be able to transfer anything to your baby. So yeah, just make sure that you're supported well, to make sure that your breast health is taken care of, make sure that your viral load is suppressed, and to make sure that your nutrition is on point so that you can be taking care of yourself as a woman to produce enough for us. Now, Elizabeth, I want to have us now the case for the special cases where it's physically impossible to breastfeed, like the mother, maybe they had surgery. What are the alternatives at the community? Or maybe the baby is not able to suckle. What are the alternatives at the community level? What some of the options that you give to these mothers who come to you with such conditions?
If the mom won't be able to, if the mom had undergone through surgery and
Elizabeth?
you can hear me? Can you hear me?
Yes, I can. I think my network is bringing issues, but bado nakusikia.
Sawa. For moms that have undergone through surgery and they're not, let's say for the C-section moms, they can still breastfeed even when after they have undergone through that surgery, they can still breastfeed. They will also be milk let down. So that is not a reason to stop breastfeeding the baby or to introduce other alternatives. No, the mom will still breastfeed. The only thing she needs there is proper support and encouraging them that they can still breastfeed. Their baby will are still depending on them, and they should not be stressed because maybe at that time they have not gotten the breast milk, like the letdown, because most of the time after CS, it's, I don't know what really happens, but I think the medication interfere with what the milk let down, and you find that within the first 1 hour you're not able to produce breast milk for the baby, and but after some time you will be able to, there will still be milk let down. So it is also possible. The only thing they need is to know that breast milk will come. They just need to be patient. Yeah.
Yeah, the patient's part, that is why support is talking to someone who understands what they are doing, someone with expertise, experience, and training on the same. So please kindly, let's normalize support after childbirth. And we need to remember that sometimes support makes all the difference when it comes to producing milk. It does. So as a woman, do not usikue champe. Hakunanga champion wa kuteseka. Jipende kidogo, look and seek for support and accept it as much as you can, especially if you are on these specialized cases, if you're on medication, if you have surgery, if you have special needs, just make sure that you communicate and you have a community. If you don't have a community, please look for the community health promoters in your area to look for a community. And again, if that is not working for you, because sometimes tunaogopa mdomo na mdomo watu ni mingi, just look for something or look for professionals. We are bounded by laws to ensure that we keep our clients' data and privacy. So ethically, we cannot talk about clients to other even clients. So yeah, if your community is not working for you, look for professionals and seek assistance as much as you can. So this woman who wants to go back to work, reality is when you leave your baby for a few days continuously, your milk supply dips. So what are some of the things that you do at the community level to support it? Because I want to understand, because I'm telling you where I am, the community support for breastfeeding is non-existent, because no one has approached me. So I really want to learn from what you guys do for this woman who wants to go back to work. What is her support look like? And do we include her family? Does she come? Do you involve her husband? Because you said that you're involving the grandmother, you're involving the mother, you're involving the community health promoters. What about the fathers and the community that you come from? I don't think the men are involved in childbirth or even child nurturing at all, at all. So how difficult is it to involve the father, and what are you doing to ensure that you overcome the challenges? Because I'm sure hiyo ni ngumu kwenye umetoka.
Yeah, especially my community, it has a lot of issues when it comes to the father being involved when it comes to childcare. So most of the time, what I depend on personally, I depend on the mother-in-law and maybe the sisters or anyone, any other person away from the husband. Though communicating to the husband when they come to the clinic, sometimes you might even be there at the clinic, and when the husband has brought the wife, but you see he does not come to communicate to the nutritionist or any other healthcare worker. He's just seated there outside waiting for you to finish up with the people he had brought, so that they can go back home. You know how it's very weird. Like they think that the person they have brought to the hospital is the one to be seen by the doctor, and the only information they need is the mom to get it and the baby, or the mother-in-law. The three of them are far much better than him. He does not associate when it comes to child in terms of motherhood. The only thing they associate when it comes to providing, ensuring that the mom has that is where they are very good at, and to make sure that they have slaughtered as many goats as possible or as many sheep as possible to ensure they have consumed enough soup during that time, which is okay. It is still okay, but where the problem comes in when it comes to getting the information from the healthcare worker, they are not. So for the mom that is going back to work, and in this case, talk about a mom in the village who her station of work is going back to, either she attends a market, or either she has or either she goes to kuchunga, where I am working at the community setup. That is their work and it is their source of income. So they are also included in that setup. So I normally, some of them accept taking their infants while they are going for their chores, which is okay for the both of them, and they will still continue ensuring that the baby is breastfeeding exclusively. That is after 3 months, because they normally take a period of 3 months. It's like a setup of 3 months maternity leave, not documented in this state. It's just someone deciding that I'll be indoors for the next 3 months, taking care of my baby. And after 3 months is when I need to go and get involved in the community activities or the household activities that I'm supposed to go through to undertake that I had delegated to someone else, like ensuring the homestead is everything is well put in place. So in this setup, most of them end up hanging out with their kids, and in some cases, like those that are, let's say, those that are working away from their infants, I just show them how to do expressing, hand expressing, and if they are well off and they are the modern type where they can acquire breast pump. There is also another way of showing them how to express breast milk using the breast pump, and also in that setup show them how to store and ensure that their baby continues taking breast milk the entire time until they are 6 months, where they will introduce complementary feeding on the 181st day. Yeah.
Great. I think one of the things that we should congratulate your men or the men from the MA community or the pastoralist community is on the aspect of provision. They really take it seriously when it comes to breastfeeding and taking care of a new mom. And that is also important, you know. You are, as a mother, you'll be comfortable knowing that kazi yangu tu ni kukaa, kunyonyesha na kulala, you know. I know it's not easy, but of course the community, the larger community, as you said, there's the mother-in-law, there's the relatives, the community women, they will come in to help here and there. Hata huyo mwenye anakupeleka clinic should be clapped for, because I know a good number, even with the ones that are still going 50-50 on provision, they still don't take their women to clinic. So saa zingine we give, tunapiga makofi where it's deserved, and that is well deserved. But again, hapo tu kwa kukaa nje pia waingishe tu polepole. I don't know how that is going to work, because I understand it's almost impossible. So pia saa zingine tunakubali tu, it is what it is, na life inasonga, sindo? And I like the fact that you have stated how to support mothers. And I think the 3 months inaanga tu ni ile yenye tume grow up tukiambiwa after 3 months the woman's body recovers, you know. That is from childbirth. If you had a vaginal delivery, after 3 months, you're usually set to go. Shida ni maneno ya kukatwakatwa mamwili, it becomes a problem. But I'm not against C-section, good people. If you need it, please go. That is why it was established and discovered, so that it can save lives. So sikubali kukufa ati juu nilisema ati uta recover haraka. Please do it. Anyway, on other notes, we have social media, and we cannot ignore it. Even whatever we are using currently is social media right now. And we have used it, or it has been established as a good source of information for majority of women who are looking for information on breastfeeding. Unfortunately, the same social media, we have kina the Yummy Mommy, who are the motherhood content creators rebrand, they stopped, they got to other types of content. We have kina the Huzna Rose, do you teacher the Huzna Rose, jua ni Huzna mani Hasna. Huzna Rose, if you find time, go through her content. She gave birth maybe last year. She gave birth when I was pregnant, so she gave birth maybe last year, but last year, and her baby was on formula full time, like full time. My baby was on formula, and you see her audience is not a small audience. That the percentage, ukiangalia, if you audit her audience, wengi ni wanawake. And you see, if those women are like that, they're like, Husna alibebana na mimba yake kubwa, akazaa, amenunua substitute, amepea mtoto, she's doing well, yeah, anaendelea vizuri, ana thrive. And then Mumina is there telling me to breastfeed. Husna didn't go through the cracked nipples. Husna didn't go through the sleepless night. Because you see, when you're overfeeding, most women tend to overfeed babies with the substitutes. So mtu ana oversleep, mtu analala, ananona. So how are we going to mitigate that noise? What are some of the things that you're going to do to overcome, and some of the myths that you've also come across? Because one of the myths that I've come across is formula feeding is good for the mother. Ideally, because you sleep better at night without waking up. But that is not good. Let's remember that breastfeeding also has some advantages for you as a mother. You're going to lose the weight. You're going to have better hormone regulations. You're going to have better reductions of risk of breast cancers and ovarian cancers. There's also the aspect of emotional regulation and bonding with your baby. That is very important for mothers in your new era. So I think you can tell us how we're going to mitigate the noise, and then you can also help us with some few myths that you have come across on social media, because you're also a creator. I follow you.
Okay, thank you on that question.
Elizabeth?
Yes, I can hear you. Okay, so on that question, in terms of formula, what I've always been saying, and this is something that any mother that I get across or any congregation and we are women, I am always talking about breast milk. And talking about breast milk, I tell them the advantages to the mother, the advantages to the baby, and everyone. In fact, lately I'm even using the SIDS syndrome, where I am telling them if you give this, the previously I attended a boot camp, and through that boot camp, I noticed that when you give your baby breast milk, they will always be alert. And after every 2 hours, they will be there waiting, expecting you to breastfeed them again. But let me tell you, when you give them something heavier than breast milk, a good example, let's say maybe cow milk, it will be hard for them to digest. So they will sleep all along. And sleeping all along, they won't be able to know that they were supposed to wake up at a certain time after 2 hours or 1 hour, depending with whatever they had consumed. So those are some of the issues that they face. You might end up losing a baby because you had overfeed them, and now the baby, when they're very young, they need to learn to be alert. And when they are not learning, because that is breast milk that will help them to be alert, because they will have digested, and after some time they will need to wake up because they need another refill for their tummy. So if you give them cow milk, we will end up losing a baby. And that is one of the statistics in that setup I saw. So I have been using this information for the moms that I am getting, that we are coming across, or anytime I'm at the village setup and I'm meeting moms and I'm telling them, let me tell you what you need to feed your baby. It's only breast milk. Why don't we give the cow, or let's say the goat or the sheep in this setup community, why don't we give them our breast milk also to consume? Meaning they're not supposed to consume our breast milk, and the babies should not also consume cow milk, goat milk, or sheep milk. So in that setup, and for those moms that are the modern moms and they know about formulas, I tell them the best is breast milk. Stop finding any other. Sorry about that light. Anyway, we can continue. And also for that setup, I also tell them that they need to breastfeed because the baby needs the breast, the importance of it to them and to the mother, and how the baby will still be gaining weight, and it is readily available. It's just there. You don't need to warm it for the baby to get it. It's always there, and the benefits are on a wider range to both the mother and the baby. Yes. Sorry about that. I've the lights,
And I like
electricity imepotea,
it's
so
okay, it's okay. No worries. That yangu ikipotea nabaki in darkness. Hata wewe unajaribu uko na light backup, mi sina. It is well, tutaweka candle. But we are almost done. But again, I like the fact that you have introduced seeds. That is another thing that is not even talked about. Aki, it's so sad. There's so much gaps when it comes to newborn care, breastfeeding, and maternal nutrition that ukianza kufikiria about it, it's too loud. Like me, I know friends, I know people who have reached out after they've lost their baby. And I can tell you, inakwanga so sad that someone lost their baby because of something very small, kitu kidogo tu hivi. Mtu amefika kumpea yani hata kulala, analala mchana, umelala naye mchana, umempea uji, anakosa kuamka. Ulimpea uji akakosa kuamka venye umesema, na akalala akilala, it's quite sad. So as you are saying, that is a very good angle, and I think you should, because I also started that somewhere, and nika we are back. The burden of the debts that come with it, because I asked a very simple question, then kapata some heavy responses, not negative one on what I had asked, because I had asked, have you heard about seeds? And then watu wakaingia inbox wakaniambia, oh, I did, my friend, my partner, and after the loss, it's usually so heavy. So I think when I'm in a better place emotionally to handle all that, hopefully soon, because I think I was dealing with the trenches of postpartum, they were really your time nikianza hiyo kitu. I was just like 3 weeks or 4 weeks postpartum. So I think, and I think you can also do that. And my internet is going again. So I think we should be winding up kwa sababu sijui kama umekuwa ukinisikia Elizabeth, but I was talking to myself.
Yes, ninakusikia, though you're breaking, but ninakusikia.
Okay. As we part, as we close for the night, if there's a mother that is struggling with whatever that you have taught tonight, and they are watching us, what is something that you want them to go home with? You know, it's breastfeeding week, and we are strengthening what works. Support is one thing that works, that has been shown to promote, to support and protect breastfeeding. So that mother who's watching us, what is something that you want them to go home with? Elizabeth,
Umepotea. Aya, umemaliza? Okay.
I think I'll have to buy that.
You can hear me?
I internet ilipotea. Yes, I can hear you.
Okay, for a mom that is struggling with all the various breastfeeding challenges that we have talked about, you're not alone. Consult a healthcare worker, consult people near you. When you visit the clinic or you're near a health facility, just walk in and ask any questions. No matter, you might feel that they are not of good importance, but they are of importance to you, you'll be given the best explanation by a healthcare worker. Ask, don't be there fighting on your own. Breastfeeding is the best the best meal you can provide for your baby, and it is possible through support, protection, and promoting. Let's champion for breastfeeding all the time in order to achieve a better and healthier baby during this time, during those periods of breastfeeding, the 2 years period of breastfeeding. Yeah.
Thank you so much. Thank you so much. And as we continue championing for breastfeeding, let's remember that no woman is meant to do breastfeeding alone. Even in our recent times, like from what my mother tells me and from what I have heard with other women, breastfeeding was never meant to be done by one person. It's a community affair. It's something that requires support. So as women, do not be scared to seek support. Be vigilant, advocate for yourself before we start advocating for you. You know, we are looking for a perfect environment where the woman's needs is well taken care of before the problems arise. But currently, before we get to you, as me, I've said I'll start an initiative. I'll try and build like a community of women and mothers here and see how far it can go. And then that is also something that we can take up. Let's try as much as we can to build that community for support. And we need to continue this conversation on breastfeeding, not just during August. Inafaa kukua continuous so that we can be as loud as the noise around it. Because I followed so many creators of motherhood and breastfeeding, and the misinformation is real. Ukiangalia comment section, mtu anasema mimi nilipea mtoto uji na 2 weeks, mimi nilipea na 3 weeks, mimi alinipigia kelele nikampea, because they don't understand that a baby can be crying for other reasons, and sometimes that milk production might require patience, and lactation is also something that can happen even after the baby has stopped. I've also followed other groups and with women from the Western region, that is the more developed nations, the global north, and I can tell you for a fact that awareness, being in the knowledge, knowing what is right and what is wrong, makes all the difference. Stuff when you unaona kwa comments, the way they are chatting, the way they are replying to problem, it's totally different from what our women are actually responding to. Kwa hizo comments utaona mtu akisema ati I've given up my baby porridge or I've given my baby purees at 2 weeks. It's always either breastfeeding or maybe the substitute, or most of them are actually advocating for breastfeeding. They want to latch, they want to pump, they are looking for alternatives, and the comment section is so mature. They are supporting that. Ukikuja huku kwetu ukiona mama ameandika au mtoto wangu analia sana, how can I increase my milk supply, the first comment will be mpe uji, mtoto anasikia njaa, mpe maziwa ya ng'ombe, mtoto anasikia njaa. So it's always Elizabeth, you are still in?
Yes.
Maneno si ya KPLC, maneno ingine sasa inaleta complications mbili tatu. But asante sana for being an amazing guest. I'm not usually like this. Hata internet behavingi hivi, it's usually very smooth, lakini leo imeamua things must get complicated. Una venye breastfeeding inapingwa hata na mpaka na internet. Imagine, sio kwako ni KPLC, kwangu ni internet. Ona changamoto za breastfeeding are real. So we continue talking about it until hizi changamoto ziishe. Thank you so much for creating time. Hebu unaweza tuambia where to find you. She's on Instagram. She does awesome content on anatengeneza pia ghee and butter and you can tell us all that. Tuambie alafu tuambie kwa heri.
Okay, as you had heard earlier on, my name is Elizabeth. You can find me on all social media platforms at Ntalalai the Dietitian. Check out the meals that I normally share, some of the insights I do. I also do farm content. I am also a farmer. I'm also a farmer, just on a later note. You can go and see my social media platform and see. Yeah. And follow for more on that end. Let's continue breastfeeding our babies. Ensure that all our babies exclusively breastfeed for the 180 days, and also continue breastfeeding until they are 2 years. Don't get tired. Consult another mom. Make your own support group as moms, and let's not champion for uji or any formula. Let's just champion for breastfeeding. Yes, and in terms of complementary feeding, reach me out on my page. I'm very good when it comes to child nutrition and maternal nutrition. Yeah, thank you. Thank you, the nutritionist corner, for this opportunity. I'm thrilled to be here, hoping for more conversation in the future.
Definitely. I will leave your number, your contact number, and a link to your IG page in the comment section on the LinkedIn page under this conversation. So if someone wants to reach out, they can definitely reach out and have a conversation with you. Remember, support is there. You just need to look for it in the right places. And once you get the right support, things will be okay. Ya mama ndio best. And with that, let's continue supporting and celebrating breastfeeding through the month of August and through the year. Ikuwe ni kitu tunafanya kila siku. So from us, kwaherini. If you had a question, a comment, we'll leave it again. We always encourage you to leave it in the comments. We'll definitely discuss or further the discussions there. Good nightini.
Good night.